I'm Dr. Michelle Plaster, and you're listening to Between Two White Coats, a weekly podcast where we dig into key issues surrounding health and wellness. I'm a family medicine doctor, and my co-host, Amber Foster, is a family medicine nurse practitioner.
In our combined 30 years in medicine, we've seen a lot. We are taking some of our biggest questions, obstacles, and patient-centered advice and wrapping it into a 20-minute weekly podcast. Make sure you hit subscribe so you don't miss an episode. If you have found this podcast helpful, give us a 5-star rating and review. This helps other people find our podcast. And make sure you share it with your friends. Thank you for your time. We look forward to serving you.
Today we want to do our next episode on our mental health series, and we're going to talk about the stigma of mental health. The negative thoughts or associations that go with just about any mental health diagnosis and even not diagnosis. Mm-hmm. I'm stressed, I'm overwhelmed. These are things that people often feel a judgment when they say. And goodness knows, for way too long, there's been an association of all kinds of negative things with any kind of mental health diagnosis that just simply doesn't exist with other diagnoses.
Absolutely. I tell patients all the time, I don't care what the diagnosis is. I don't care what the mental health diagnosis is. If you're getting treatment and you're getting better, keep doing that.
Yes. What if your brain is the sick organ? Mm-hmm. What if your pancreas is the sick organ, or your liver, or your skin? It does not matter. Mm-hmm. If the brain is the sick organ, we get help for it. And to be honest, if the brain is the sick organ, to me, it matters even more because it's the decision maker. But then sometimes that's part of the problem. And there can be a self-stigma because your decision maker is sick. So your decision maker is telling you all kinds of things that don't make sense. You would not be thinking like this if your decision maker wasn't sick. And so you start saying things like, well, I'm just not trying hard enough. I can do better. I can fix this. Or you have, in a lot of different mental diagnosis, you have messed up thoughts, that you have negative thoughts that just keep repeating themselves. So what if the negative thought is you're not good enough? You'll never be good enough. You're not going to go and get help because you're not worth the help. Mm-hmm. Don't waste the money on yourself. Other people matter more. You can fix this. So I think sometimes there's a self-stigma that is simply because it's your decision maker that's not doing a good job. That's a little bit off right now. Yeah. There's also a self-stigma because we have fed stuff into people. That's just not true. Yeah. And so what if you've lived in a home or an environment where depression isn't an illness, it's weakness. Yeah. Or anxiety is, well, you're just a worried kid. Or suck it up, son, suck it up, daughter. And so if that's what you've grown up with, then you start to believe that to be true. And I say to people all the time, many times the voice in your head started as someone else's voice. And so you've been told that this doesn't matter or that you can fix it yourself by someone who didn't have information.
And that might have been suffering as well,
Yes, there is a genetics to mental health. Yeah. And so if you were raised by depressed parents who were in all levels of denial about any of their own concerns, then you've been fed a lot of misinformation that you may have accepted to be true. And now you're giving yourself this horrible self-stigma. And you don't believe that you deserve or should go ask for the help. Yeah.
Then you're scared too, because then you're like, oh no, what am I going to do? Just the whole, they get panicked. Yes. And then that's a whole nother level because they won't get help.
What if your problem is anxiety? Yeah. And the sick organ of the brain makes you anxious. And now you have to conjure up the ability to go ask for help when you're scared to death to go into the doctor's office and talk about this.
And mention it, yeah.
And so the anxiety, or what if the brain is working against you in depression, and a big part of depression is often apathy. Mm-hmm. I just don't care. Yeah. So I just don't care to get up and go get the help. Yeah. And so there is a lot of struggles and hurdles that go to getting help for this that don't exist with hypertension and diabetes. And then there is the social stigma. And this is where I think that all of us who are blessed enough to not struggle with mental health can do a better job to make life easier for the people who do. Mm-hmm. We do not need to continue to have the dialogue or the inaccurate beliefs that this is a choice, This is how we know depression is not a choice. It still exists.
Yeah.
If this was a choice, it wouldn't exist. Absolutely. Because no one would choose depression. No one would choose OCD, anxiety, or any other mental health disorder. It is a terrible place. I have a wonderful, trusted family member who has struggled with mental health his entire life. And he is wonderfully brilliant and does a great job of taking his medicine and seeing his doctors. But he has told me that if he had the option of cutting his arm off and never struggle with bipolar or depression again, he would cut his arm off in a second and just live life with one less limb, because that would be easier than what you go through when you're struggling with mental illness.
Absolutely.
And so no one chooses this. So if you've ever for a second thought that someone chose this, if you hear nothing else, please stop thinking that. It's so far from true. There's a lack of understanding. When the brain does funny things, it makes us uncomfortable. When we see it in other people, it makes us uncomfortable. People get uncomfortable just even if someone's talking to themselves. I run a out loud dialogue on things a lot. It's hard to keep this brain straight. And people get uncomfortable with that. Different things that are out of whatever your norm may be makes people uncomfortable. And so if whatever's going on with one person makes other people uncomfortable, we want to push that to the side and compartmentalize it. And we just haven't known a lot about the brain for hundreds of years. There's been so much that has happened since the advent of Prozac, which is in our lifetimes. Yeah. The doctors before us didn't have all this information.
And there's, when you were saying that, like the new information, if you go back and even look in like film and television and the things that we're putting in front of, our kids about, and I think it is getting better, but if you go back, it's always the crazy people in the padded rooms. And so of course that's a social stigma.
How scared would you be to ever have an inpatient admission for mental health if you watched any of these old movies?
Yes.
Yeah. And that's what we're feeding our culture. And words like hysterical, that, hysterical sounding a lot like hysterectomy comes from uterus, because women were hysterical. And so there's this whole cultural belief system that women would be hysterical. And then you didn't want to say that anything was wrong, because then they're going to think you're hysterical. And believe me,
I'm hysterical
Hysterical
sometimes.
is not a diagnosis. You and I have both had it plenty of times. Ask any mom what happens on the 400th time that their child says, Mom, Mom, Mom. You go hysterical. Yeah. I have often said, say Mom one more time and you will watch my head explode. There are a lot of things that can just make us feel like in that moment we are completely overwhelmed. And then someone calls you hysterical. Then someone calls you crazy. And so then when you really are in a place that you need some help, you don't want to be called hysterical and crazy, so you don't tell anyone, because we've socially made it clear to you that makes us uncomfortable. We're going to call you names, so keep it to yourself.
Yeah.
The history on even demonic possession. Is that person possessed? Is that, what's wrong with them? If we don't understand anything, we like to wrap it up in a box that is them, not us. Mm-hmm. And then we've put people into this box that they don't want to admit or say because it has such negative belief system behind it, or their life, they've heard so many negative things associated with it. And we in our culture and in society need to stop doing that. I'm going to put you on the spot on this because you're raised by a brilliant pastor. Let's talk about even the cultural belief system from different religions.
Yeah, which I can't speak for all religions, but my faith base is Christian. And so I think a lot of times people will say, well, you can pray more, or, and although that may be true, like we all could pray more.
We could pray more for
all
everything.
Day long. Yes,
everything.
But if there is a true imbalance, God made medicine. Like he gave us knowledge about things like Prozac and other medications and therapists. And so I think sometimes, even though those people mean very well by what they're saying, it can be harmful, because then that the person who's struggling with that feels like, well, I can't go to my faith-based place
because
for help.
I've clearly failed
Yes.
as a whatever. I failed as a Christian. because I've obviously not been praying enough, or else I wouldn't.
I don't
have
trust
depression.
God enough. I had a lady this week that has said she's going through some transitions, and she said, I told you last time that I was just going to pray about it. And she said, and I'm telling you this time I need medication.
Yeah,
and so I told her, I said, because we had the conversation. Absolutely, I agree with that. But if you need something, you need to come back to me. Don't struggle with this alone. Like, it's a safe place. It's okay if you need help, more than just, what you feel would be a failure if you were put on medicine.
Absolutely. And this is what I don't understand. And I've been a church goer my entire life. And I am a super spiritual person. Why can we pray for our brains and heal them more than we can pray for our pancreas or liver?
Yeah.
If we believe in miracles and healing, then we should say to everyone who is sick of any form equally, well, you should pray for your liver, and then your fatty liver will go away.
Has nothing to do with the McDonald's that you're eating.
It has nothing to do. Just pray more on it.
Yeah.
And pray more about your diabetes. And I'm not saying that people don't say that, but we tend to take the brain and any illness associated there and act like it's a choice, or that we could pray and that God will intervene on our brain differently than he would intervene on any other organ. And really my point of all of that is to say the brain is an organ that gets sick.
Yeah.
And there is no stigma that should exist about your brain getting sick. This brings me, and we're going to talk more about suicide in the depression series, but it's a tough thing to talk about, but we got to talk about it more. And this brings me to say, if your brain gets sick and you commit suicide, that is death due to illness, not choice.
Yeah.
And we struggle with suicide, and we struggle with who to blame. And we never look at who to blame for cancer. We never look at who to blame for heart failure. But if your brain works against you and is extremely sick, and it leads to a place of delirium and bad decision making, and it takes you over, then that was not death by choice.
It's death by suicide.
Death by suicide. And death by suicide, I think we can categorize right there next to death by any other organ failure. Your brain failed, where your heart could have failed or some other organ could have failed. And we put that in the same category. We have stigmatized mental illness. We have stigmatized suicide. We have acted like it's a choice. We have acted like it, different than other things, could be prayed to be better. We have used terms like crazy and hysterical in such negative ways.
Well, even personally, like, I'll tell my kids when they are saying, Mom, y'all do not make me act crazy. Like, I find myself even saying things that I would never say to anyone, as far as like a patient.
But you know, and I use crazy like I would use stupid, or I'm not talking about it as a diagnosis or an illness.
Like
I'm talking about it as a behavior.
Yeah.
And so I act stupid sometimes. I act crazy sometimes.
Yes, but even then, sometimes I'll catch myself, because then I'll hear my children repeat that back to me. Don't make Mom act crazy. I'm like, oh my goodness, what am I doing to my children?
Yes, and then what we need to never do is act like crazy is a synonym for any other mental illness.
Yeah.
That crazy is a behavior.
Yeah.
All of us do it sometime.
Yes.
It's an adjective. We can use it for all kinds of things.
Yeah.
But let's not use it for someone who's struggling with mental illness. Let's not act like, in some people's brains, crazy and mental illness is the same.
And it is not.
And it is not. For me, crazy is sometimes a choice. Once I act crazy at home, people
I'm
start
definitely
acting better.
Yeah.
So it truly is the way that we phrase things around this, and that we don't call people certain phrases with no sensitivity.
Which when like you said the word stupid, and I told my kids, when they're little, that you don't call people stupid.
Not a nice word.
We're not saying those things. And so that's why, so even saying the word crazy, me honestly joking, I've really tried not to do that, just like I say, not stupid,
a nice word.
Because I don't want my children to not be empathetic towards people who truly do struggle, and they may not be acting crazy, but they may, that might be a behavior or a symptom, but I don't, because then that would be offensive to someone who really is struggling.
And choosing what we say and how we say it
matters for those
to make
patients.
Sure that we're always empathetic on the person on the receiving end of that. And I think we lose a lot of empathy when it comes to mental diagnosis. I think it makes us uncomfortable. It's a place that we don't like to visit. And so we just try to push it away, act like it doesn't exist. Please don't talk about it. I'm appreciative about how much we protect people's privacy in healthcare and how much we protect people's privacy for mental health.
Absolutely.
But it's frustrating for me that I can't get notes from psychiatrists, because psychiatrists have to protect so much because of how this has been misused and how people have been mistreated, that we don't get notes from psychiatrists. And I want to know and need to know this stuff. And I am as protected as a psychiatrist to keep the secrets. But, that is just where we are, that society has taken this to a point that we have to work really hard to protect people, because it can affect the jobs they get. Yeah. It can affect the way they're treated. It can affect so many different things that other illness doesn't.
Yeah.
So all of this to say, I don't know why we do this. We've attempted today to try to explain the stigma, but I don't think I can explain something that makes zero sense to me.
Yeah, absolutely. I was going to say some of it too is that society's learned behavior. So it's easier, like you said, just to put it in that box. And so I always tell patients when they do open up to me is like, I'm so proud of you. Like, good for you. Let's get this fixed. Like,
good for you for saying the hard thing to say.
Yeah. So if you're struggling and you're like, oh, some of this is, sounding true to me, like, we're proud of you for thinking that. Like, well, let's get some help.
So let me use an appropriate use of the word crazy and stupid.
Yeah.
The stigma around mental health is crazy and stupid.
Yes.
It makes me mad. It should never exist. But the fact is, it came from somewhere, but it doesn't have to be carried forward. Mm-hmm. And we all can do a better job of making sure that we embrace, love, and support people who are struggling in these ways, just like we would injury or illness of any other organ. So let's make a commitment to destigmatize anything related to our brain. It is not our fault. We did not choose it. And there are ways to fix it. And if we can support people better, then we can really encourage them to go get that help. Next week, please join us as we welcome the brilliant Dr. Sherry Hawkins. She is a psychotherapist, a PhD, and a clinical professor. She's going to help us sort through what kind of different resources exist for help with mental illness, how to distinguish different types of mental illness, and if you in any way feel like I just might be able to do a little bit better, she's going to give us a lot of information on how to do that. We like to end you on a good note. So in this week's Tell Me Something Good, my something good is pets. I'm a dog person. I'm not sure whether you prefer fish or cats, but there's something about having a pet that just loves us unconditionally. So for all of you who love pets, go give your pet a big hug, unless it's a fish. Thanks for joining us, and until next time, take care of yourself.